This combination medication is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It may be used to treat conditions caused by low calcium levels such as bone loss, osteoporosis, weak bones, osteomalacia/rickets, decreased activity of the parathyroid gland, hypoparathyroidism, and a certain muscle disease, latent tetany. It may also be used in certain patients to make sure they are getting enough calcium, including women who are pregnant, nursing, or postmenopausal, people taking certain medications such as phenytoin, phenobarbital, or prednisone. Calcium plays a very important role in the body. It is necessary for normal functioning of nerves, cells, muscle, and bone. If there is not enough calcium in the blood, then the body will take calcium from bones, thereby weakening bones. Vitamin D helps your body absorb calcium and phosphorus. Having the right amounts of vitamin D, calcium, and phosphorus is important for building and keeping strong bones. The recommended daily dosage for calcium 600+ minerals is usually 1 to 3 tablets per day, taken with food. It is best to take this medication at evenly spaced intervals throughout the day to ensure optimal absorption. Be sure to follow the directions provided by your doctor or pharmacist to get the most benefit from this medication. When taking calcium 600+ minerals, it's important to take it with food. If the product contains calcium citrate, it can be taken with or without food. Follow the directions on the product package or as directed by your doctor. For best absorption, if your total daily dose is more than 600 mg, it's best to divide your dose and space it throughout the day. If you are using the liquid form, make sure to measure the dose using a special measuring device/spoon. If you are taking the chewable form, chew thoroughly before swallowing. For capsules, swallow each one whole. It's important to take this medication regularly at the same time each day to get the most benefit from it. If your doctor has recommended a special diet, it's important to follow it to get the most benefit from this medication and prevent serious side effects. Additionally, do not take other supplements or vitamins unless ordered by your doctor. Calcium supplements come in different forms and contain different amounts of calcium and vitamin D, so it's best to ask your doctor or pharmacist to help select the best product for you. And if you think you may have a serious medical problem, seek medical help right away. If you experience constipation or an upset stomach while taking calcium 600+ minerals, it's important to let your doctor or pharmacist know. If your doctor has prescribed this medication for you, it means they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you have any serious side effects, such as nausea, vomiting, loss of appetite, unusual weight loss, changes in mood or mental state, signs of kidney problems, bone or muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or a fast or pounding heartbeat. While it's rare, a severe allergic reaction to this drug can occur. Seek medical help right away if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking calcium 600+ minerals, it's important to inform your doctor or pharmacist about any allergies you may have, especially to other vitamin D products. This product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, heart/blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, or if you have low levels of stomach acid or bile. If you're considering using the chewable tablets, be cautious if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit sugar or aspartame in your diet. It's best to ask your doctor or pharmacist about using this product safely. If you're pregnant or breastfeeding, it's important to consult your doctor before using calcium 600+ minerals. During pregnancy, doses of vitamin D greater than the recommended dietary allowance should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. When taking calcium 600+ minerals, it's important to be aware of potential drug interactions. This could affect how your other medications work and may increase your risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not change the dosage of any medicines without your doctor's approval. Some products that may interact with calcium 600+ minerals include digoxin and phosphate binders. It's important to separate your doses of these medications as far as possible from your doses of calcium/vitamin D. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Additionally, it's important to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, because they may contain calcium, phosphate, or vitamin D. Make sure to ask your pharmacist about using those products safely. Furthermore, it's important to be cautious when using medications containing calcitriol while using vitamin D. This product may also interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you use this product. If you or someone else has taken too much calcium 600+ minerals and are experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, changes in mental or mood, headaches, drowsiness, weakness, and fatigue. Always seek medical attention if you suspect an overdose. When taking calcium 600+ minerals, it's important to have regular medical tests to monitor your calcium levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. You can get vitamin D from fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Your body also produces vitamin D when exposed to sunlight. Calcium-rich foods include dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables such as broccoli, spinach, and bok choy. There are also calcium-fortified foods like orange juice. To reduce the risk of bone disease, it's important to stay physically active, avoid smoking, and limit alcohol and caffeine intake. If you happen to forget to take a dose of calcium 600+ minerals, you should take it as soon as you remember. However, if it is close to the time of your next scheduled dose, it's best to just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. Make sure to store calcium 600+ minerals at room temperature, away from light and moisture. It's important not to keep it in the bathroom and to always keep it out of reach of children and pets. When it comes to getting rid of calcium 600+ minerals, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly dispose of the product when it expires or is no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.